All right, and we're back. I almost exposed where I'm from. I'm trying not to. I'm sure it'll come out eventually, but I don't even really know why I'm that paranoid. But I'm gonna be, just for the sake of um, my career. It's a fly. So yeah, 6 to 8 hours in the waiting time. I mean, I'm still trying to figure this out. It's a practice. It's like medicine. It's not perfect. What I was meaning to lean into is explaining how they have these billboards. There are billboards that show the waiting time, 6 minutes, sometimes 30 minutes. That waiting time is just showing you how long in the waiting room you're going to wait to be seen by a doctor. And I mean, you what, 10, 30 seconds? Saw you. Okay. So you've been seen. There are some magic words, of course, which a lot of our frequent flyers, the patients who come to the hospital pretty often know, like chest pain or mm, pain, basically. I fell, hit my head. That's another one. Or doing the whole, facial droop. If some people can rock it, and yeah, there are some there's people who've learned how to act like they've had a stroke. I've seen it. She had a stutter already, and she was getting admitted in the hallway on my med surg floor, and she just starting to fuck with me. I was like, that's a good joke. You want to go to the unit, because that's how you get admitted to the ICU, is have a stroke in the hallway. I don't know. What do you want to do? It doesn't bother me. Let's get you to the right place, because you're not gonna stay here if you just had a stroke. But she was messing with me, which is it's very funny. It's very funny. Um, my old floor, we go 6 to 8 patients, ICU 2 to 3, and the floor I started, I chose out of a residency program, and they have a nurse residency. It's so cute, and they call us nurse residents. Like we're not providers. I did 2 years of school and went straight into work, so it's not very serious. I'm just getting a grasp of what's going on and managing. I don't make decisions. I make decisions, but nothing about providing care. I'm not practicing medicine, which I say that. I say it a lot. Experienced nurses think they should be in the level of some providers because they've been there so long, but there's way more studying and practice before these doctors even show up in the hospital as residents that we don't get. We don't go through what they go through. So respect. There's a lot of backbiting between nurses and doctors and just different levels of the hierarchy. I hate that shit. It doesn't make any sense. Like, we're supposed to be about the people. We're supposed to be about these little starfish we're trying to throw back in the ocean, because a lot of them are just going to stay there and crust. No, crusty. The floor I came from was a combination of stroke and altered mental status, sometimes just demented patients who've developed a UTI and pushed them over the edge and they got super weird, but we're going to call it a stroke just to rule it out. And the good old differential diagnosis, it also makes us appear that we're treating more strokes than we actually are, which is good for numbers. It's good for business. So you got these stroke patients who sometimes it's their first time in the hospital, mixed in with dialysis patients who sometimes have never left the hospital. They're the frequent flyers we hear about. Dialysis patients barely spend time outside a clinical setting. You got either Monday, Wednesday, Friday rotations where you get dialysis, where they clean out your garbage disposals for hours at a time. They stick this giant rubber hose or plastic hose in your neck or in your arm or in your chest, and they filter your blood, mix it, and pull out enough of the garbage to hopefully keep you alive for 2 days and redo it. And some families don't get that this is a form of life support. Life support's a dirty word, but this is big deal. This is every 2 days you got to come in and clean your garbage disposals out because you have end stage renal disease. It's not not the middle. It's the end. It is very important to know that. So you got these patients mixed with these first timers, and then you toss in some infectious disease that we can't cure. I like to call it the floor for patients who can't have nice things, and I chose it. I love it. Patients pull their IVs out a lot of times, and you gotta re-stick them, so you get a lot of practice. I love it. I love sticking my difficult sticks. Patients will say I'm a hard stick. It does something special to me. I hear hard stick. Oh, do they? And they have to use the machine. Oh, do they? They have to use the machine usually to get an IV in you. Oh, put those gloves on and crack my knuckles. It makes me feel so excited. I love a challenge. I look a little insane too, because they see my face light up when generally people start to shirk away. We don't get enough practice as nurses, especially out of school. We don't have a whole lot of practice these days in school. From what I understand, these older nurses used to stick cadavers and they'd intubate cadavers and get their practice in. I miss that shit. I mean, I didn't get that experience, but I know that I'd miss it. This is very important. It's good stuff. We don't intubate as nurses, but we can stick LMAs in, which laryngeo masks, laryngeo something airways. Just like a inflated tube in their neck to help keep them breathing. So yeah, it's a great little shit show. Hospitals, I love them. It's where all the sick people go. Very important that we get you out of the hospital before you take something home that you didn't come here with. So with this, I'll wrap up. Every time I have one of these hard nights, I like to slap on Run the Jewels, so I'll end it with that, because this gets you hyped, because you could feel it at the beginning of the shift when it's going to be one of those nights where you need something hype to get you through. So thank you all for listening. If you did, sorry for the cut up, and I'll get better at this. It's Forgive My Foul Mouth Friday in Lotek. Let ourselves translate expert knowledge. I'm Brad Burns.
I am sick. I will punch your baby bear in his shit. Give me lip. I'ma send you to the yard. Get a stick, make a switch. I got